Welcome everyone to this presentation called COVID-19 and Pediatric Crohn's Disease and Ulcerative Colitis. This program was developed with collaboration of Improve Care Now and NASPGHAN with the Crohn's and Colitis Foundation. My name is Kat Soto. I am the Director of Patient Education and Support for the Crohn's and Colitis Foundation, and I'm excited to introduce to you today's presenters. Dr. Edwin de Zoeten is an associate professor of pediatrics at the University of Colorado School of Medicine. He is the director of Pediatric Inflammatory Bowel Disease Center at Children's Hospital in Colorado and is a chairperson for the IBD committee. Dr. Rachel Lawton is a pediatric psychologist for the Division of Behavioral Medicine and Clinical Psychology. She's an assistant professor for the UC Department of Pediatrics in Cincinnati Children's. We're also joined today by our Q&A panelists, Jenny David, who is a pediatric comprehensive GI psychology postdoc fellow at Nationwide Children's Hospital, Devin Summers, who is a college student and an IBD patient, Martha Stone, a parent of a child with IBD and also part of the ICN, Improve Care Now, parent working group, and Becky Wolf, an IBD patient and also participant in the Improve Care Now network. Without further ado, I'd like to introduce to you Dr. Ed de Zoeten.
Thanks, Kat. It's my pleasure to talk to you today about something that I know is on everybody's mind, and that is COVID-19, and specifically how it is affecting pediatric population and our patients with inflammatory bowel disease. So the objectives today are going to be to understand how COVID-19 is affecting pediatric populations. It's to discuss some healthcare guidance for pediatric patients with IBD. It's also to explain multi-system inflammatory syndrome in children, which used to be called PIMS. And then finally to discuss reopening and what IBD patients and their caregivers should know about returning to daily life, and then understanding how to talk to children and teens about COVID-19. Next slide, please. So before I start, I want to make sure that we're all on the same page as far as terms that are used for discussion about COVID-19. For those of you who don't know, there are multiple different coronaviruses that are found in humans, and most of them cause simple, mild respiratory illnesses like a cold. Unfortunately, COVID-19 is a new disease, and it is caused by a novel or a new coronavirus that hasn't been seen in humans previously. So when we talk about the disease that it causes, it's called COVID-19. That is coronavirus disease discovered in 2019. When we talk about the virus that causes this disease, it's called SARS-CoV-2, and that is for a severe acute respiratory syndrome, coronavirus number 2. So again, SARS-CoV-2 causes COVID-19. Next slide, please. So let's talk a little bit about the symptoms that are associated with COVID-19. Most of you have heard these. This virus appears to enter into the respiratory tract, and so the most common issues are fever, shortness of breath, and cough. But we know that things that go into the respiratory tract can also go into the digestive tract, and there are receptors in your intestine that can be activated and can bind to that virus. And so we also note that there are other symptoms that have been reported: diarrhea, nausea, vomiting, abdominal pain, as well as lack of smell and taste. The key point here is that it's really important because a lot of these symptoms actually overlap with IBD. It's important to pay attention to your body and your symptoms. And when you have the typical GI symptoms that are associated with IBD, but they're accompanied by fever, shortness of breath, or cough, you should consider seeking your doctor's advice and scheduling a visit with your physician. Next slide, please. Fortunately, in children, most cases have been mild or asymptomatic. But they can also be asymptomatic carriers of the virus, meaning when I say asymptomatic, that means they don't have symptoms, but they can still pass the virus on to others. There is limited data on the effects of COVID-19 on children with IBD, and I'll touch on a little bit of that, but most of it is coming from outside the United States. Some more recently is coming through from the US. The biggest thing that I'm going to talk about throughout this entire discussion is it's really critical to stay on your medications, and then also follow precautions and healthy practices that everybody should be following here in the United States. Finally, it's important to stay to maintain your nutritional support therapies and also continue nutritional health support. Next slide, please. Unfortunately, I can't see the slides at this point. So as I was talking previously, it's critical to continue to follow the average precautions that are being recommended across the United States. And it's also important to listen to what your local health authorities are recommending. At this point, beyond staying on your medications, it is important to wash your hands frequently for at least 20 seconds. If you don't have access to soap and water, hand sanitizers are fine, as long as they have higher than 60% alcohol. Stay home if possible, especially if you're sick. And if you need appeal letters from your physician to be able to stay at home, that should be a request to your physician. If possible, wear a face mask when outside of the home. This is actually has been defined as a primary mode of stopping transmission. It's both important for people around you as well as for yourself to wear a mask. Next, it's practicing social distancing, staying a minimum of 6 feet apart from those that you are not typically in contact with. Keeping surfaces and commonly used spaces clean, using cleaning products as appropriate. And then finally, covering your nose or mouth when you're coughing or sneezing, throwing away used tissues, and avoiding touching your face. This can be challenging with the young, avoiding touching your face. And we do see an increase in touching your face when wearing a face mask. So sometimes it takes some time for kids to get used to wearing a face mask and what that feels like, so that they stop touching and moving their mask. Next slide, please. There is the data that I was talking about earlier, which is coming through the Secure IBD database. The Secure IBD database is a program that was developed by some adult and pediatric gastroenterologists to follow patients who have inflammatory bowel disease and determine what are the outcomes of patients who develop COVID-19 with IBD, and look at that compared to what medications they are on, etc. At this point, the group is endorsed by all the different programs that you see at the bottom here, including Crohn's and Colitis Foundation and NASPGHAN, but also multiple international societies have endorsed this program. What it's doing is it's allowing us to submit our data from across the world about patients with IBD who have developed COVID-19. At this point, there are 1,925 patients that are in this database, and only 502 of those are under 30. The total number of deaths due to COVID-19 in IBD patients under 30 is 0. And fortunately, that number of patients under 30 with IBD that have been treated in the ICU or put on a ventilator is low. It's approximately 4 at this time. Next slide, please. So next, we're going to talk a little bit about some health guidance for pediatric patients. Next slide. First, I want to touch on something that has been in the news called multisystem inflammatory syndrome in children, or MISC. This was previously known as PIMS. It is a rare but serious complication associated with COVID-19, and it has been identified in patients who are 2 to 3 weeks out from having their exposure or their infection with COVID-19. The symptoms are similar to COVID-19, including persistent fever, but there are differences. Fatigue is a component, elevated inflammatory markers, which you can define by looking at the blood, but also vomiting, diarrhea, low blood pressure, swelling and redness of the hands and feet, cracking of the lips, redness in the eyes, irritation of the mouth, swollen lymph glands in the neck. These are all components of MISC. As I said, it's very rare. Here in Colorado, we've had 7 cases. but it can be a very serious complication of COVID-19, typically, again, occurring about 2 to 3 weeks after infection with COVID-19. What we're telling parents and patients is you shouldn't try to self-diagnose this problem. If you're concerned about this, you should talk to your doctor. And then if you feel that you have it, you shouldn't try to treat it yourself. In reality, you should go on to find care. Next slide, please. So if your child is experiencing any of these serious illnesses, including this redness in the eyes and other places, as well as fatigue, low blood pressure, other things, difficulty breathing, chest pain, extreme lethargy, so being extremely fatigued, altered mental status, including confusion or delayed response, or a concern for dehydration, we recommend that you immediately seek attention at an emergency room, or if it's severe enough, 911 is the number to call to be certain that you are safe. Next slide, please. So let's go a little bit more into the medications and what the current recommendations are for medications in patients who have IBD. In IBD, we utilize a lot of immune suppressing medications. That is because in IBD, our immune system is overactive and the body can't control or regulate its overactivity. This is what is causing the inflammation in the intestine, and so most of our medications are aimed at modifying that immune response. Some medications for IBD may increase the risk of infections. And so we are always concerned about fever and other things in patients with IBD. Next slide, please. This list of recommendations came out of the International Organization for IBD Research, and it looks at all the medications that we use for inflammatory bowel disease. And as you can see, it talks a little bit about the different examples, such as aminosalicylates, which are 5-ASA medications, also known as Pentaso, Rawasa, or others. These are not immune suppressing, and with most of these medications on this list, you can see the recommendation is to continue taking that medication. The one exception to this suggestion of continuing these medications are steroids. High-dose steroids there's a suggestion that there may be an increased risk of developing COVID as well as it persisting and causing downstream effects. That does not mean you should stop your steroids at this time. It also does not mean that all steroids are made the same. So budesonide, or also known as Entecort or Uceris, have not been shown to have significant effects on the development of COVID or the side effects of that disease. Other ones, such as methylprednisolone, Medrol, prednisolone, and others, do have that concern. And so it's important that you talk to your physician about the possibility of starting to decrease that dose and decreasing as much as possible. In general, steroids are not recommended in high doses in IBD anyway, but we do recommend that you talk to your physician about decreasing when possible. Steroids are a critical part of helping patients who are in a flare. So again, speak to your physician about this. When we talk about the other immunomodulators, biosimilars, or biologics, we need to realize that these medications have not been shown to cause more severe disease, more severe COVID-19, or issues that require intensive care. And there are some suggestions that there may be some small minor benefits of these, but definitely there is no increase in symptoms. So overall, this big slide that talks about a bunch of different medications, what's most important is to understand you need to stay on your medications and speak with your physician when you have an issue. That's okay. Next slide, please. So what should I do about IBD medication infusions? So if you're on a medication that's infused at a hospital, at an infusion center, or at home, it's important that you ask these infusion centers or home infusion programs what they're doing to protect you against COVID-19. So we ask questions like, is there a screening protocol to check in for symptoms of COVID-19? Will there be adequate social distancing, at least 6 feet? Are there visitors restricted? Typically they are. Will masks be needed to provide, or will they be provided for patients and the healthcare team? And then how many guardians are allowed to go in with the child? It's important to prepare your child prior to going into an infusion center and talk to them about how the appointment may be different or also encourage proper hygiene habits, staying away from others, wearing a mask, washing hands, etc. When we talk about home infusions, the same questions exist for the home infusions as they do for infusion centers. You just have to ask the infusion company, how are they ensuring it's a safe option for your child? And then talk to your doctor and make sure that you feel it is a safe option. Ask the same questions. Does the home care company have a screening protocol for COVID-19? Are masks required? What are the sanitizing protocols between infusions? And also, in this case, how many homes does the nurse go to daily? And what is their sanitizing protocol between visits? Next slide, please. So next we come to procedures and testing. Are these important? Should we continue doing them? Do they increase our risk for COVID-19? Well, routine colonoscopies and endoscopic procedures are now again happening in most centers across the United States. So it's important to speak to your doctor about the benefits and risks of these procedures. Most patients should be pre-screened for high-risk exposure or symptoms prior to going in under anesthesia or getting a colonoscopy or upper endoscopy. And then many centers now are requiring a COVID test prior to anesthesia. Typically, that's 48 hours prior to an anesthesia event or having a procedure. The reason we're doing this is because we need to protect the healthcare workers, and because upper endoscopies and anesthesia are all done around the respiratory tract and in that space, it's critical to know whether or not COVID-19 is an issue. For active symptoms, it is really important not to delay care. And it's very important to continue your regular healthcare maintenance. One of the things I've been talking to my patients a lot about is obtaining the flu shot. You definitely don't want to have the flu and COVID-19 at the same time. So it's really important that we obtain our vaccines and stay healthy in that way. It is also important, if you have symptoms, to contact your physician. Symptoms are, just because you have symptoms doesn't mean you have COVID-19, but it is critical, and it doesn't mean that by going to see your physician you will have issues with developing COVID-19. Speak to your doctor, as your child may need to have an endoscopic procedure or come in for a visit. The other option frequently is to use telemedicine, which can be a useful option where exposure is not necessary. But it is critical for all these things is not to delay care. Finally, remember, keep a list of all visits that you had to have postponed. Don't lose track of them. These are important. You should obtain, once the pandemic concern is over, you should make sure that you are getting these procedures completed or these visits completed. Next slide. Finally, diet and exercise for pediatric patients. This really takes us into the mental health aspects as well as health in general. Nutrition and exercise are key for healing, immunity, and energy levels. They help prevent or minimize GI symptoms. They maintain normal bowel function, and they prevent growth delay. It's really important during COVID-19 and this pandemic to encourage good nutrition, exercise, and maintain good health. This will help mentally, it'll help physically, it'll help in many different areas. Next slide. So from here, I'm going to hand off to Dr. Lawton, who's going to talk to us about returning to daily life. Thank you.
Hi guys, thank you so much. I actually cannot see the slides. If you could put those up. Awesome. So I'm a child psychologist at Cincinnati Children, and we've been helping families weather the last 5 months of chaos in as much of a predictable way as possible. And we're going to spend the next couple minutes talking about really returning to daily life, or what the new normal for daily life is, and keeping as much of our emotional health and well-being intact in that process. Next slide, please. So these guidelines reflect what we just heard, and really try to provide structure and consistency and routine for day-to-day life. So we really want IBD patients and families to follow local guidance, their physician's guidance, local health guidance, and follow proper hand washing routines and hygienes, maintain social distancing, wearing face coverings outside the home, If people are sick, we want them to stay home and out of the public so we can maintain health for everybody else. And we want to avoid contact with people who we know are sick or who may be sick, regardless of whether or not there's an active COVID diagnosis. I think, yes, there's a role for health and well-being for this, but one of the other functions is that having a routine, having consistency, a structure, and a plan also helps us feel better and more secure in our day-to-day lives than if we're going through things without a plan. And so having a set of rules and guidelines can actually be really helpful in reducing anxiety overall. We've been having a lot of questions with families about social circles, opportunities for socialization during this time. And unfortunately, at this time, it's really best to limit activities and social engagement to immediate family only. While school is out, we really would prefer that families not have contact with in-person play dates with children from other households. And again, the function of this is really just to preserve as much health as possible and to decrease the likelihood of contamination from one house to another. If children are playing outside of their homes, ideally we should try to create as much distance between them as possible. So going for that 6 feet range for anyone that's not in their immediate household. Next slide, please. So returning to school, this has been a giant question that we've fielded over the last probably 6 weeks or so. And unfortunately, there's not a lot of consistency state by state, city by city. It tends to vary considerably. The other point of frustration that we're hearing is that plans for an individual school or an individual district are changing over time. And while this is really frustrating, on one hand, it's actually good because it means that they're changing their plans depending on the severity of the outbreak in their area, which we would want them to do. All states are different with plans to return for school, and this may be varying by state, by city, and by district. And we really encourage families to talk with their GI, their pediatrician, local health department for specific guidance on what each child should do because it's going to vary situation by situation. For kids that will be going back to school, we want them to really consider a couple different things. One, is there a safety plan in place? So we really want some kind of screening going on at school. Ideally, masks should be required, not just recommended. Is there adequate hand washing and sanitizer available? What happens if there's a COVID exposure at school? Or what happens if your child comes home and then has symptoms? The other question is, how many students are in a classroom? Can there be social distancing at school? Is this a plausible option? I think, again, all of these questions are great in terms of maximizing a child and family's health. The other thing they do is they help make us feel safe and they help make us feel secure. And help improve anxiety in this setting if we know that we're doing everything that we can possibly do to keep a child safe. Next slide, please. So when should we be more cautious? We want to be cautious if the child has been newly diagnosed with IBD and they have active disease. Active inflammation in the context of COVID, we've learned is less ideal. If they have severe inflammation, so if your child's in the middle of a flare, that may not be the best time to take big risks. If they're currently taking steroids, so we know that steroids are one of those medications that does increase risk, and so that would be an absolute important conversation to have with your physician. Or if they have moderate to severe malnutrition. So in other words, if your child is really struggling from an IBD standpoint, even more important to talk with your physician about what his or her preferences are in terms of your child returning to school. When is it safe to go back? We really want to wait until prednisone is tapered down. We want to wait until that inflammation is under control, that child's symptoms are decreased. If there is an outbreak in your child or someone in your family has been exposed, we got to keep them home. So we got to follow that 14-day quarantine. And we want to really discuss the risks and options concerning chronic conditions outside of IBD. So if your child has asthma, for instance, or if your child has diabetes or RA, we really want to make sure we're looking at a whole child approach, not just a GI approach, because all of those factors are going to impact a physician's recommendations. Next slide, please. So emotional and mental health, this is what I spend most of my day talking with families about. We know that the last 5 to 6 months have been extremely hard for everybody. It's not how anyone chose to spend the summer, and so there's been a lot of adjustment, a lot of disappointment, and a lot of frustration, and we get it. I think that there are a couple things that we're really encouraging families to try that could be helpful in not only minimizing the frustration and disappointment, but also reducing the anxiety that goes along with so much uncertainty. One of those big things is we got to cut back on social media. I think there was an article recently where I saw the word doom scrolling. This happens all the time for us, where we have the news on or we have social media on our phones, and it's just a little bit of an overload in terms of access to and availability of COVID-related information. A little bit of information is great. Too much information, unfortunately, is sort of like a system overload, and is gonna, instead of reducing anxiety, it's gonna make anxiety worse. And so we really wanna set pretty strict limits on where we're getting our information from. We wanna make sure the source is good, and we wanna make sure that we're taking it in bite-sized chunks only during certain parts of the day. So sometimes I'll recommend that families identify that 5 to 6 p.m. is the social media hour, the news hour. We get all of our information from the same place, and then that's it. Really controlling social media access and avoiding times where we're just scrolling through story after story and lots of numbers and scary facts and figures can really help to reduce anxiety. We want to make sure that we have a plan. So whenever there is something that's chaotic, scary, uncertain, having a plan, structure, and a routine is really, really, really helpful, not just for our little ones, but for grown-ups too. So we want to make sure that we have all the supplies we need, all of the things that we may potentially need in the future, whether it's medications, meals, food, things like that, really making sure that we feel as secure as possible. If you find that you're getting stressed or your child is getting stressed or that they're irritable or really frustrated, totally expected. But absolutely ask your GI, your pediatrician for a referral to a mental health provider, and we're more than happy to talk through some of these things as well. We have to find coping strategies that work. So sometimes I'll joke with families that there's tons of good options, but if we don't do them and we're not excited about doing them, then they're not going to be effective. And so we have to find something that your child enjoys doing, that they can do at home, can do in a safe way given COVID, and that actually is helpful, that we see boost their mood, makes them feel better. Ideally, we're having kids get outside. So we want to spend a little bit of time outside every day, and whether that's taking a walk or going to the park, whatever we're doing, provided that it's safe and social distanced, is awesome for mood and emotional health overall. And then we want to make sure we're finding support. So whether that's with the IBD Health Center, the community website, the Power of Two program, Facebook support groups, all of those things are particularly special in any circumstance, but specifically right now, we know that those are going to be extra helpful given that patients with IBD are going to be experiencing this pandemic in a little bit of a different way than the average population, given that there are layered concerns related to health. Next slide, please. So when we think about emotional and mental health and COVID, we're really having families think about 3 specific facts. So when big and scary things happen in the world, they make us feel unsafe and they make us feel like we don't have any control. So when we're helping kids feel better and more secure in that setting, we really want to remind them of their safety. We really want to find ways to reinforce that they're safe and that mom and dad are doing everything that they can to keep them from getting sick. And that tangibly means that we want parents to lean into those safety routines as much as possible, reminding kids that there are actually a lot of things that they can do to help keep themselves safe, like washing our hands, using our cough pocket, wearing masks, keeping lots of social distance between people, all of these things, yes, they're really, really good for health and well-being, but they're actually really good for emotional health as well, because they help the child feel safe, and they are all things that they can control. The child can do them themselves, which helps reduce that sense of anxiety and uncertainty. We want to use facts. We want to make sure that we're describing what's going on in language that's not emotional, but rather grounded in the reality of what's going on in the world right now. And that it's tailored to the developmental level of the child. And last, to use an old Mr. Rogers quote, we want to look for the helpers, showing kids where people are going out of their way to actually support the communities, whether it's doctors, nurses, social workers. Where there's community involvement, we really want to point that out because that reaffirms this idea that we have control and that the world is safe. Overall, we really want parents to also be mindful of your own anxiety. This is an completely unprecedented time for almost all of us. And so really giving yourself a pat on the back and credit for making it through this far, but then also recognizing and sitting with the fact that this is really anxiety provoking. It's really hard for everybody, particularly if you're raising a little one that has IBD. And so we want to make sure that you're getting as much support as well. Next slide, please. So behavioral health concerns and symptoms have been extremely common among pediatric IBD patients during this time. They're present among all kids, but also among kids with IBD because it doesn't change the fact that COVID is stressful and anxiety provoking. In fact, it may make it more so. So we have a couple strategies here about how to have those conversations with your kids. The first one is we want to ask what the child knows. And so we really want to get a sense as to where they've gotten their information from and what they know. Information that comes from a peer is going to be different than information that comes from the TV versus Facebook versus Twitter versus a newspaper. And we really want to make sure that they're getting their news from a good source. Secondly, we want to know what they know. And this is important because as adults, we want to make sure that we're able to correct any misunderstandings or misassumptions about what's actually going on in the world. The second part is we want to ask what the child is worried about. And the way we usually frame this for kids is, what are your biggest worries? This not only lets the child know that the parent is open to having conversations about this, but it gives them permission to talk about those big, scary things that go along with a global pandemic. We often have parents get worried, well, I don't know how to answer it. I might not know the answer to the question. All of that's totally fine. If we don't know an answer, that's completely okay. One of the things we might say is, you know what? I don't know that. Let's look that up together. That gives parents and kids control. We know where they're going to get the information, and you can make sure that the kind of information that they get is tailored to how old they are. The last part is we want to answer their questions in small, child-sized, age-appropriate responses. So the general recommendation that we have is we want to keep our answers honest and candid. Kids are really receptive to honesty, and we want to make sure that we're not misleading or lying to them. We don't want to misconstrue the situation. Kids are an excellent judge of what's factual and not. And so we want to make sure we're giving them facts and that we're honest. But we want to make sure that we tailor that answer to how old the child is developmentally. And the way that we do that is by changing the amount of details that we share. So a 6-year-old is going to get a different amount of details than a 10-year-old, than a 15-year-old. And overall, we just want to make sure that the child feels like there's good flow and information back and forth. So if they have concerns in the future, they can ask. Additional talking points can be found on the CCF website by the link below. Next slide, please. With this, I think this was, I'm turning it over to the presenter.
Yes, thank you. As I unmuted myself, I appreciate it. Dr. Lawton, thank you so much for that great presentation. And I wanted to share with everyone just a reminder of some of the great resources and research that's underway to help patients and parents become familiar with the data and be a part of this information. So the Secure IBD Registry, which tells us a lot about what cases and what the data looks like for COVID-19 among inflammatory bowel disease patients, provides de-identified information that is completed by the healthcare professional. And the website to this registry is below. So you can talk to your doctor if you are a patient that has had COVID-19 and want to encourage your physician to ensure that your information is in this registry. It will help under a greater understanding of how this impacts patients overall. The current data section, there's a section where you can track the outcomes in IBD patients. So please view this link on the site to find more information. And there are certainly clinical trials for COVID-19, drug trials, and vaccinations that are underway. And on our website, we have a listing of some of the places where you can find information or participate in some of these, this research. I want to also thanking, of course, our collaborators, Improve Care Now and NASPGHAN, for their collaboration in this program, but they also have resources for patients. Improve Care Now resources can be found on the websites listed and includes toolkits, guides, and other resources. And NASPGHAN also has a general website, resources for parents and patients in the gikids.org, and a link to information around COVID-19 in the gikids.org COVID-19 section of their website. The Crohn's and Colitis Foundation also offers numerous resources for pediatric patients, their parents, and also pertaining to COVID-19. So we encourage you to view the links on this site and visit them for more information and support from our community. And I want to just remind everyone that this recording is, the information shared in this recording is updated as of August 10th. And so there may be more updates and information shared. And if there are further developments around COVID-19 and inflammatory bowel disease, you can find updates on this guidance by visiting the website on the slide that you see here under the COVID-19 information and events updates section. And now is time for our Q&A panel. So I want to welcome all of our panelists onto our screen to share their webcams. I'll give a moment for everyone to do that, and I will stop sharing my screen for a moment and allow everyone to come on. Wonderful. Thank you so much, everyone, for joining. And before we begin, I had the pleasure of giving a formal introduction of Dr. Ed Zoeten and Rachel Lawton. I want to ask our other panelists to please introduce themselves. And let's start with Dr. Jenny David. Jenny, would you please introduce yourself?
Of course. So my name is Dr. David. I'm a postdoctoral fellow at Nationwide Children's and specializing in kids who have chronic GI conditions, predominantly IBD. I myself have inflammatory bowel disease and also live with an ostomy.
Thank you for joining. Martha, would you please introduce yourself?
Sure. I am Martha Stone. I'm a parent of 2 children, one of whom has IBD. And we are with the OU Children's Medical Center in Oklahoma City.
Thank you very much. Let's go over to Devin. Devin, would you please introduce yourself?
Hey guys, I'm Devin. I'm a rising junior at Greensboro College. I was diagnosed with Crohn's in 2011 in the spring of my 6th grade year. And I played baseball for Greensboro College as well.
Welcome, Devin. Becky, would you please introduce yourself?
Hi everyone, I'm Becky. I'm a rising freshman at University of Michigan, and I was diagnosed with Crohn's disease when I was 7 years old back in 2009. So it's been a while. I'm also active with Improve Care Now's Patient Advisory Council.
Thank you all for joining this evening. I want to start with questions for Dr. Edwin Zoeten. You talked a little bit about parents having concern over procedures and testing. I wanted to ask you, how can parents make an assessment about symptoms? Should they become urgent or change? How should parents make a decision or communicate with their healthcare team if they're trying to assess whether it's something that they should go for their inflammatory bowel disease? What do you advise parents and patients to do?
Yeah, I mean, that's a great question. I think it's a challenge. I think the most important thing is what you said, is communicating. Communicate with your physician and their nurses and explaining the symptoms, and come to a decision together. You're not alone in this, and so your physicians and your nurses should be able to help as much as possible. The biggest thing, I think, is something that I said in my talk was, if there's severe lethargy where you're just so sleepy you can't get up, if there is shortness of breath, if there's any suggestion that there's a change in your mental status, so meaning any suggestion that they're not answering questions the way they should, or they're not acting the way they should, or they're walking funny, those are all reasons where I would suggest that you seek medical care quickly. But use your resources and talk to your physicians, talk to your nurses.
Wonderful. And you had mentioned a little bit about steroids. Now, it seems that there may be a lot of concern around risk of steroids. Does this increase my risk? What should I do if I am on steroids? Can you reemphasize your guidance around thinking about steroids and risks in pediatric IBD?
Yeah, I mean, going back to that original statement, don't stop your medications. Talk to your physician about it. Steroids have been identified as one of the things that may increase your likelihood of having issues with COVID-19. But if you can decrease them gradually the way it's supposed to be, don't stop them because that can cause its own problems. But if you can gradually decrease them, that would be the recommendation at this point. There are lots of different forms of steroids, so some of the steroids may not have the same effect, and you may even see in some of the recent reports that there are steroids that can be helpful when you're very, very sick with COVID-19. That being said, at this point, looking at steroids like prednisone or solumedrol, those two steroids, I would talk to your physician about gradually decreasing them to a point where they're no longer causing issues.
Thank you, doctor. I'm going to pose the next question to our psychosocial experts, Dr. Rachel Lawton and Dr. Jenny David. One of the biggest concerns we may be hearing from patients is the isolation that children may be experiencing now. As you know, IBD can already present challenges with social isolation and activities and friends. How do we ensure children stay supported during this time? Who wants to start?
I think that's a really, I'll start since I already started talking. I think, to emphasize a lot of the things that Dr. Lawton has already talked about so eloquently, first and foremost, I think it's really important to normalize these feelings. It's normal to feel upset. It's normal to have some of these big feelings about not getting to see friends, not getting to go to Camp Oasis or other things that are fun that kids look forward to for many, many months. Once we normalize them, then at least kids can feel like they've been heard and their feelings have been validated. I think we're all trying to do this, both for kids and teens and adults, finding some creative ways of staying in touch with one another. So be that like Zoom calls with family and friends. There's lots of fun apps that I've learned from families that they've been using to stay in touch with one another and being kind of creative about that. Even things like snail mail and things that we haven't done a ton in our recent history, that can be another wonderful way of staying connected.
Yeah, I echo everything that Dr. David said completely. I think the reality is that this is really tough for most of us, and echoing that to kids is validating and helpful and gives them the ability to reflect that, yes, this sucks sometimes. The other thing that I would add is that I think that sometimes what we see is that part of that adjustment, part of that anxiety, part of that frustration can come out in irritability. And so parents may need to more strongly encourage these social efforts than they would under normal circumstances. And so it may be that kids say, I don't want to do this, or I don't really feel like it, or I don't really want to do it. They may not want to FaceTime me right now. Totally normal under these circumstances. The message that we would want to send to parents is we want them to do it anyway. So we're going to expect that they may not want to, but chances are after they get started, they're going to enjoy it. And so we want to have these scheduled social times, whether it's once a week, once every other week, whether it's Zoom or FaceTime or talking on the phone or playing with the social apps, the games. We want to get them scheduled, and we want to have a plan that even if we don't feel like it, even if we're sure it's not going to help, even if we feel like just lying on the couch and watching Netflix, we're going to do it anyway. With the idea being that actually the more we do it and the more we push ourselves, not only the better it feels, but we actually enjoy that time with friends.
That's very sound advice. Thank you. One of the questions that actually one of our panelists had suggested is touching on if a patient is at higher risk, how should they navigate social situations, peer pressure to disregard safety measures and irresponsible roommates and family, etc.? How do we navigate those concerns?
I think this is really hard. I think navigating social circumstances and peer pressure is hard under any circumstances. And now we're asking vulnerable kids to expose their vulnerability to everybody and stand up for themselves in a way that's really hard. Ideally, we want to stay grounded in facts. And we want to avoid sort of placing blame on anybody, really putting other people on the defensive, and really just share what the experience is like. So I have IBD, I'm on medication that puts me at risk, and I'd really appreciate it if you could do X, Y, or Z. Really setting those clear limits, clear boundaries, that's something that all of us struggle with. So sometimes what I'll have kids do is actually practice saying that to me in session. Practice saying it to their parents, practice saying it to their friends who they know are going to be okay with it, just so they become more comfortable with it. Having that opportunity to practice setting boundaries and limits with friends is good under any circumstances, but particularly in the context of IBD, where it's not just COVID that could exert social norms and peer pressure. There's a lot of other things in high school and college that could influence that as well, and we want them to feel more empowered in speaking up and defending themselves.
I think
Wonderful.
also just
Jenny,
building.
anything to? Yes, please.
Yeah, thank you so much, Guy. I think building off of everything that Dr. Lawton shared, it's also really helpful for kids and teens and young adults to recognize that they also have a larger support system. So let's say, you practiced it in session, you tried it out, it doesn't go so well. What do? We can still call mom or dad, call our doctor, call someone else who can be a good support for us, and maybe there's another way that we can say it in a different way, have it written down, whatever it might be, but just recognizing that you're not alone. There's also other people who have IBD and a larger network of people who can be really supportive when things don't go as planned, even if you did all of the hard work and did all of the practice.
I think the one other thing I'd add on to that is, as heartbroken as all of us are that Camp Oasis wasn't in person this year, myself included, I think that those social networks that come from camp can foster a lot of solidarity. And as we've been doing cabin chats and medical Q&As over the past couple weeks, one of the things that we've been hearing is how kids and teens are sort of standing up for themselves and navigating these circumstances. And so leaning on your camp friends and understanding what they did, how they solved these problems, what risks they were comfortable taking might be really helpful also.
Wonderful. That's a great suggestion, is leaning on those in the community, because no one can understand you like another patient, right? I'm sure many people agree with that. I'm going to pose the next question to our parent, Martha. So Martha, as a parent, what have been some of the challenges that you've experienced during this time? And what, if any, have been strategies that worked for you and your child? I know you have 2 children, one of which has inflammatory bowel disease. So talk to us a little bit about what you've experienced there.
Well, In March, when we first got the stay-at-home orders, the biggest challenge was with my non-IBD child, because as we have already mentioned, IBD is already isolating, and so my son who has IBD was already in virtual school, so going to virtual school was not any different for him. But for my daughter, that was quite a big change for her. So I just made sure that both of my kids, who both see counselors, that they continued to see their counselors, and they knew that they could talk about these items and their concerns with their counselors. They could talk about their concerns with us. And I even started something with my son. When he comes to talk to me, I ask him, do you want me to help or do you want me to listen? And so that way, I know what I'm supposed to be doing, because I'm a mom. I want to help. I want to fix it. And sometimes he just wants a listening ear. So I know if that's what I'm supposed to be doing. We also have, my son has been in a non-flare time. So he's been feeling great. So we haven't had any issues with missing doctor's appointments. But as Dr. Zoeten mentioned, if you have missed any doctor's appointments, anything with your general practitioner or specialists, if you've missed lab work or other non-essential procedures, make sure you write that down and you follow up and you continue to keep that on your list to monitor so you get those things done. So that's what we've done.
Thank you, Becky. I want to pose the next question to Devin. I'm sorry, I called you Becky, Martha. The next question is for Becky and Devin. As young adults with IBD, what have been your strategies to keeping yourselves mentally and physically healthy during this time? Let's start with Becky, and then we'll go to Devin.
Sure. Yeah. So for staying healthy, I've been, of course, following guidelines, wearing a mask everywhere in public, staying 6 feet apart, washing my hands frequently. And beyond that, I've also been trying to make sure I get to exercise and eat well, and doing self-care, taking me time, doing things I enjoy, just kind of, doing things that make me happy in this stressful time. I've also been, monitoring my symptoms, GI and other, just to make sure I'm feeling okay. And another thing I've been doing to feel healthy mentally is to really kind of maintain my social connections. So I've been doing a lot of virtual connection with friends. I have scheduled Zoom times on Sunday afternoons with one group of friends. I have Zooms with other groups of friends. And it's been definitely interesting, but I've actually gotten a lot closer with people. And so I think that's been a really helpful way to make me feel healthy, to make sure I'm maintaining that social interaction.
That's great. Devin, how about you? Oh, I think we may have lost Devin for a moment. We will come back to him in a moment. I'm going to ask the next question to Dr. Zoeten. With school being a hot topic right now, people deciding, should I go virtual or should I go back to school? For some places that are still, parents may be still deliberating on that decision. What are some important things that parents of IBD patients need to have in their checklist of things to think about, not to make the decision, help them make the decision? So I'm asking not for you to tell us what to do, but how should we think about it? How should parents think about it?
I wish I could tell you what to do. That would be a lot easier. Yeah, I'm a parent of 4 kids, and my kids are age 7 all the way up to age 17. And it's a hard thing for me as well. We've had, I think there's been 3 changes in the last 2 weeks as far as what's going to happen. When are we going to do in-person, virtual, half and half? It's been quite a challenge, and I feel for all the parents out there trying to figure this out. I think, for most patients with inflammatory bowel disease, the risk is not any greater or than any other person. So you can take it in this way. I asked the question, is there going to be an availability of social distancing? Are masks going to be required? These are things that I would would want, not just for my own children, but also for the rest of the family in the household, the parents, as well as for the teachers that are at those schools. I think we have to think about all those things. And so, you know, those two questions are paramount. What are they doing to try to, and it depends on where your child is. And as I said, I have a span. I have children who are in high school who they're changing up the schedule in such a way that it may actually significantly affect them taking AP exams or other tests, as well as ACTs, SATs, and things for college. All these things are playing a role in our decision making. But I think the most important is what are the protections that are in place for my child and for our family? What are the protections, and are they going to be able to stick to that? That's the challenge. Here in Colorado, many schools have just now said that they will be virtual at least until the middle of October, if not all the way through December. And I think for me that I feel better with that, and my kids do not. They're not happy about it. But I think you know, it's really about maintaining safety, and so as I said, I can't make the decision for you, but I do think there's those kind of questions of whether there's face masks, social distancing, et cetera, and how they're going to deal with that are going to be an important part of your decision.
Thank you, Dr. Zoeten. I know we're running a little low on time, so I'm going to ask Devin to share how he's staying healthy mentally and physically, and then we'll jump to questions from our panelists to our experts. So Devin, would you please tell us how you're keeping healthy?
Yeah, as a college athlete, health and fitness has really been a big part of my life. Just trying to stay healthy. You know, college schedules, especially with baseball, can get really stressful and strenuous on my body. So I try to eat healthy when I can. I love to cook, so that's been my best option with trying to stay healthy. Working out every day, try to do a workout 4 to 5 times a week. Of course, wearing my mask if I have to go out in public. Just those little things to keep me mentally and physically sharp, just to get me through this really tough time.
Thank you, Devin. And so I'm going to open it up for our patient guests and our experts to just engage with each other in a Q&A. So Martha, Becky, and Devin, I wanted to allow you a chance to ask our experts, knowing that this is being viewed by many parents of IBD patients and potentially some IBD patients as well, a question that you think is on top of their mind that you'd like to ask. Let's start with Martha.
Okay. Is there anything that we should be including in our child's 504 plan that is related to virtual learning? We've got one for my son who will be a freshman in high school, but is there anything that we should be including related to virtual?
Can I jump in here just with a quick thought? Is that okay? This is a fabulous question, and we've been fielding it day after day for the past couple weeks. I think there's a lot of question marks right now for how 504s and IEPs are going to be implemented in this new context. And we've heard from some districts that how they were implemented in our sort of fast-paced conversion to virtual in the spring might be different than how it's going to be implemented in the fall. So I would talk with the school and ask what their plan is at baseline. From an accommodation standpoint for a 504, some of the things that we're really hoping to have parents ask for and advocate for would really be identifying what's a plausible schedule and amount of work for a child to accomplish from home. And so there's this idea that the hours spent at school should be the same hours spent at home learning, and the reality is that that's really hard to do. And so we want to make sure that the amount of work and the time in class learning is titrated as needed for the child at home. And so if the child at home can't sit for more than 30 minutes, then we're going to work in 30-minute blocks. If we're going to turn our homework in by creating our own videos where we talk about the books that we read or talk about, what we read in our history textbook, then we're going to do that instead of maybe perhaps writing a whole essay about it. We're going to be really creative about how we're spending our time at home, with the recognition that without the structure and support of school, things are going to have to look a little bit different. In general, the big thing that we're emphasizing is structure, structure, structure. And so if a 504 can help build in that structure, like identifying specifically how much time is going to be spent on each subject, or giving allowances to reduce some of that time at home, or to provide extra additional support with online face-to-face guidance from teachers, then that would be our go-to.
And just to tack on, I think Dr. Lawton covered everything when it comes to 504 plans. I think some other things that we've been talking to families about in terms of general support and structure within the home, kind of outside of a 504, I'd really encourage families to think about where their children are learning. So let's, as best as possible, not be learning on our beds. Maybe there's a designated like office space or desk space, maybe still within the bedroom, but not on the bed, to protect sleep quality. So thinking about kind of where kids are learning, like Dr. Lawton was saying, kind of structuring out specific breaks. So if every 30 minutes, if every 60 minutes, we get, a 5-minute wiggle break, or we get a snack, or we get to like watch a favorite YouTube video, that's great. That helps us stay on task and builds in some natural reinforcers. So things kind of outside of a 504 that can also make online learning more comfortable for everyone, especially when parents might also be commuting virtually as well.
Excellent, thank you.
All right, Devin, let's go to your question for our experts.
Okay, yeah, I know I've suffered from anxiety, these past couple of years with college and with baseball, and, handling social situations. And I know coming into college can be really, stressful. And I wanted to know who throughout the IBD community can patients reach out to when they get anxious. And I know Dr. Lawton touched upon it earlier, but I just want to continue the question.
I think that's great. It's a great question, and I wish it was a question that people were more vocal and open about asking earlier rather than later, because anxiety is so much easier to tackle earlier rather than waiting for it to build and build. Ideally, we hope that you're comfortable bringing up this question to your GI provider. On the pediatric end, a lot of pediatric practices have a go-to mental health team that they're able to refer to. This changes a little bit as patients transition to the adult communities, and they may not have that resource readily available. The other thing you can do is contact your primary care physician if you still have one. But for kids that are actually on campus at college, one of the things that we would really hope that they can lean into is the student support network that's there. So whether it's student counseling, whether it's talking with a social worker at your school, really being open in that way is fantastic. And utilizing the available resources that are there, whether it's through your GI's office or through your campus community, is a really, really good place to start. You can also go on websites like Psychology Today and things like that, and actually look up GI-specific providers if you're concerned about like IBD related anxiety or just anxiety providers in general. And that can give you an idea of who's available in your community and who takes your insurance and things like that. But ideally, we'd want you to use recommendations from your doctor's office and in your local community, because they know the providers the best, and it would be a really good place to start. I don't know if Dr. David, if you have any additional suggestions.
Just a couple of quick things. I think that was all super, super helpful. I think especially within a collegiate setting, and Devin and Becky, I'm sure you could speak to this much more than I can, being out of college now. We often have really wonderful friends around us, and that's great. We want to use our friends for support, and it can be a tough thing to decide about. When do I need support from a friend, and when do I need support from a professional? Both things are wonderful, and both things should not be stigmatized. And I think just being mindful about, I'm getting lots of support from friends, that's great. I need something extra. We have to remember that friends are not trained in psychology or behavioral health, and that doesn't mean they're not great friends. It just means that we might need someone else on our team. And so following all the recommendations that Dr. Lawton pointed out about our GIs, our PCPs, and student counseling on campus can also be great when we need more than friends and family.
Dr.
you so
Zoeten,
much.
do you have anything to add to that?
Yeah, I was just going to add that, you know, the Crohn's and Colitis Foundation does have support groups that are available, and for all ages, and that might also be an option in your area. Many of them have moved to virtual. I know our children's group has moved to a virtual setting, so it's an opportunity to talk with other people who have IBD, who might be able to, and also are likely going through some anxiety as well, and might be a good opportunity to speak up there.
Thank you. And I'm just going to add that other than support groups, we also have a peer-to-peer program where you can connect with someone that you think you relate to via an app. So it's called our Power of Two program, and it's definitely something to consider. So please, for those listening, our support programs are available to you as well. And Becky, I wanted to hear from you. What is the question, the burning question that you have for our experts?
Yeah, so a question I have is, as places are reopening and students are going back to school, there's going to be more social opportunities and general events that are going to be increasingly in person, like going to get coffee with a friend, having a play date, a birthday party. And so considering that increase in social gatherings and whatnot, I'd be curious to hear what factors you all think are most important for patients to keep in mind when deciding whether these individual opportunities are safe and a good idea to attend.
That's a tough one. You know, I think it goes back to those basic principles of masking, 6 feet distance, etc. You know, all of us want to interact with human beings. It's a really critical part of our life. And it can be done somewhat safely as long as it's not in large groups. We talk a lot about cohorting and finding a group of people that you are going to focus on, that you can come to an agreement with, that you'll be as safe as possible, and then that understands that you want to wear a mask, you want to keep that distance. Those are that type of cohort is really beneficial. You get the opportunity to still interact with other people, but also realizing that they are doing the same things you are, which is masking, 6 foot distance, keeping your hands washed, not touching your face. So it is going to happen. It is already happening. People are trying to reach out a little bit and branch out a little bit, and I think there's a component of that. If you can do that outside, now's the time to do it because it's warm weather. At least here it's hot. So now's the time when you can be outside and still maintain that distance.
I would also add, when we have parents and teams trying to sort through this, sometimes it's helpful to sort of reorient families towards sort of what they value. So think about what your biggest values are. Obviously, particularly for IBD families, health is going to be a big one. And it's going to be a value that really dictates behavior a lot of the time. But if your second highest value is maintaining in-person social relationships with friends, then it makes sense to try to do that, provided that you're doing it in a safe and social way. I think when we think about what's most important to us, what we really value, what really sort of rings home, and use that to help guide our behavior, that's a way that really helps us orient sort of what do we prioritize and what's okay for us to say no or try to convert to a virtual setting.
And when there are times where maybe the family and your providers have cautioned you, maybe it's not the best decision at this particular time, maybe there's ways within your immediate family that you can have some special nights. So maybe you can have a picnic in the living room, have like Halloween, even though it's not quite October yet, but do things that are special while you're still staying home and staying safe.
Thank you.
Thank you very much. Thank you. I want to conclude by first saying thank you to all of you for your participation, your expertise, your openness, and willingness to jump on and share your personal experiences. We are so indebtedly grateful for your participation in this. So thank you so much. And I also want to again extend gratitude to the Improve Care Now Network and NASPGHAN for their collaboration in this program. We look forward to sharing the recording soon. Thank you all and have a wonderful night.
Thank you.